Nursing exam daily quiz. Question 1. What is an initial sign of nephrosis that the nurse might note in a child? Raspberry-like rash, periorbital edema, temperature elevation, abdominal pain. B. Periorbital edema, correct answer. In nephrotic syndrome, edema is a common symptom that is generalized and not easily noticeable, even by parents. However, an early sign that can be assessed by the nurse is periorbital edema, which refers to swelling around the eyes. This can be an initial indicator of nephrosis and may prompt further evaluation and intervention. Question 2. Why is it important to assess for in a child receiving prednisone to treat nephrotic syndrome? Infection, urinary retention, easy bruising, hypoglycemia. A. Infection, correct answer. When a child is receiving prednisone to treat nephrotic syndrome, it is crucial to assess for infection. Prednisone suppresses the immune system, making the child more vulnerable to infections. Since steroids can mask typical signs of infection, it is essential to look for subtle symptoms to ensure prompt treatment and prevent complications. Question 3. During a physical assessment of a hospitalized 5-year-old child, the healthcare provider notes that the foreskin has been retracted and is very tight on the shaft of the penis. They are unable to return it over the head of the penis. What action should the healthcare provider implement? Forcibly push the foreskin down over the head of the penis. Place a warm compress on the penis. Notify the healthcare provider in charge. Wait a few hours and try again. C. Notify the healthcare provider in charge. Correct answer. The correct action is to notify the healthcare provider in charge of this occurrence of paraphimosis. Paraphimosis is a urologic emergency where the foreskin is retracted and becomes tight, potentially impeding blood flow to the penis. It is crucial to seek medical intervention promptly to prevent complications. Question 4. A 7-year-old child with acute glomerulonephritis has gross hematuria and has been confined to bed. What is the most appropriate nursing intervention for this child? Providing activities for the child on restricted activity. Feeding the child a protein-restricted diet. Carefully handling edematous extremities. Observing the child for evidence of hypotension. A. Providing activities for the child on restricted activity, correct answer. The most appropriate nursing intervention for a 7-year-old child with acute glomerulonephritis experiencing gross hematuria and bed rest is to provide activities for the child on restricted activity. Although the child may feel well, it is essential to limit activity until hematuria resolves to prevent complications and promote recovery. Question 5. Which urinary diversion procedure is the least damaging to the body image of the adolescent? Urostomy, ileal conduit, nephrostomy, suprapubic placement. B. Ileal conduit, correct answer. In the context of pediatric nursing, choosing the least damaging urinary diversion procedure for an adolescent is crucial to their physical and psychosocial well-being. In this scenario, option B, ileal conduit, is the correct choice. An ileal conduit involves creating a stoma using a small piece of the ileum, which diverts urine to an external pouch. This procedure is less damaging to body image because it allows for a more discreet and manageable way to collect urine. Adolescents can conceal the pouch under clothing, leading to less self-consciousness about their condition and better body image preservation compared to other options. Option A, urostomy, involves diverting urine through a stoma in the abdominal wall, which can be more visible and potentially impact body image negatively. Option C, nephrostomy, involves a tube directly from the kidney to the outside, which can also be cosmetically challenging and impact self-esteem. Option D, suprapubic placement, involves a catheter inserted above the pubic bone, which may still be visible and not as discreet as an ileal conduit. Educationally, understanding the psychosocial implications of different urinary diversion procedures in pediatric patients is essential for nurses caring for adolescents undergoing such surgeries. By choosing the least damaging option like an ileal conduit, nurses can support adolescents in maintaining a positive body image and overall well-being during a challenging time in their lives. Question 6. The mother of a 5-year-old child taking prednisone for the nurse he needs to get immunizations to enter kindergarten. What does the nurse clarify about receiving immunizations while on prednisone? Can interfere with the treatment for nephrosis. Require that the child have antibiotic coverage. Can be given in smaller, divided doses. Should be delayed. D. Should be delayed. Correct answer, rationale. The correct answer is D. Should be delayed. Prednisone, a corticosteroid, suppresses the immune system, reducing the body's ability to mount a proper response to vaccines. Administering live vaccines such as MMR or varicella to a child on prednisone can lead to an inadequate immune response and potential vaccine failure. Therefore, it is recommended to delay live vaccines until the child has completed the course of prednisone and their immune system has recovered. Option A, can interfere with the treatment for nephrosis, is incorrect because receiving immunizations while on prednisone does not directly interfere with the treatment of nephrotic syndrome. It is more about the effectiveness of the vaccines themselves. Option B, require that the child have antibiotic coverage, is incorrect as antibiotics are not typically needed when delaying vaccinations due to corticosteroid use. Option C, can be given in smaller, divided doses, is incorrect because the issue with prednisone and immunizations is not about the dose size, but rather the compromised immune response while on prednisone. In an educational context, understanding the impact of corticosteroids on the immune system and vaccination efficacy is crucial for pediatric nurses to provide safe and effective care to children with chronic conditions like nephrotic syndrome. Delaying vaccines until the child is off prednisone allows for better protection against vaccine-preventable diseases. Question 7. A child with nephrotic syndrome has not experienced diuresis after a month on corticosteroids. What protocol can the nurse encourage to induce diuresis? Ibuprofen, an anti-inflammatory agent. Furosemide, Lasix, a diuretic. Ciprofloxacin, Cipro, an antibiotic. Cyclophosphamide, Cytoxin, an immunosuppressant. B. Furosemide, Lasix, a diuretic. Correct answer. If diuresis has not occurred with corticosteroids in nephrotic syndrome, a diuretic like furosemide, Lasix, is the appropriate choice to promote diuresis. Furosemide works by increasing urine production and reducing fluid retention. While ibuprofen is an anti-inflammatory agent, it does not directly induce diuresis. Ciprofloxacin is an antibiotic and is not indicated for promoting diuresis in this scenario. Cyclophosphamide is an immunosuppressant, not an antisuppressant, and is not typically used to induce diuresis in nephrotic syndrome. Question 8. Which food should be avoided by a child with acute glomerulonephritis to prevent hyperkalemia, as recommended by the nurse? Dairy products, whole grain cereals, organ meats, bananas. D. Bananas. Correct answer. In pediatric nursing, understanding dietary considerations for various conditions is crucial. In the case of a child with acute glomerulonephritis, the correct answer is D. Bananas. Bananas are high in potassium, which can exacerbate hyperkalemia in individuals with impaired kidney function, such as those with glomerulonephritis. Limiting potassium-rich foods like bananas is vital to prevent further complications. Option A. Dairy products are generally restricted in chronic kidney disease due to their phosphorus and potassium content, but they are not specifically highlighted for hyperkalemia in this context. Option B. Whole grain cereals, and Option C. Organ meats do not have a direct association with exacerbating hyperkalemia in acute glomerulonephritis. Educationally, this question highlights the importance of tailoring dietary recommendations to specific health conditions in pediatric patients. Nurses play a key role in educating families about dietary modifications to manage conditions like acute glomerulonephritis effectively and prevent complications like hyperkalemia. It underscores the significance of individualized care and the impact of nutrition on pediatric health outcomes. Question 9. Which assessment finding for a 4-month-old infant would require further action by the nurse? The posterior fontanelle is open. The infant has good head control when held upright. The infant is able to roll only from abdomen to back. The anterior fontanelle is open and soft. A. The posterior fontanelle is open. Correct answer. In this scenario, option A, the posterior fontanelle is open, would require further action by the nurse for a 4-month-old infant. The posterior fontanelle typically closes by 2 months of age, so its persistence being open at 4 months could indicate a potential issue with normal growth and development or increased intracranial pressure, necessitating further assessment and intervention. Option B, the infant has good head control when held upright, is a normal developmental milestone for a 4-month-old infant, indicating appropriate muscle strength and coordination. Option C, the infant is able to roll only from abdomen to back, is also a normal developmental milestone at this age, as infants typically develop the ability to roll from abdomen to back before mastering back to abdomen rolling. Option D, the anterior fontanelle is open and soft, is a normal finding in infants, as the anterior fontanelle can remain open and soft until around 18 months of age, allowing for brain growth and development. Educationally, understanding the significance of fontanelle closure and developmental milestones is crucial for pediatric nursing practice. This knowledge helps nurses identify deviations from normal growth and development, enabling timely interventions and promoting optimal health outcomes for infants. Question 10. The nurse is providing care for a pediatric client in the emergency department, ED, with a diagnosis of decreased level of consciousness, LOC, secondary to increased intracranial pressure, ICP. Which healthcare provider order should the nurse question? Passive range of motion exercises to promote hip flexion. Oxygen at 2L nasal cannula to maintain saturation above 95%. Hourly vital signs and neurologic checks. Elevate head of bed 30 degrees. A. Passive range of motion exercises to promote hip flexion. Correct answer. In a pediatric client with increased intracranial pressure, ICP, and decreased level of consciousness, LOC. Passive range of motion exercises to promote hip flexion should be questioned, as they can potentially increase intracranial pressure. This action may not be safe for the client's condition. The other options are appropriate interventions for managing a pediatric client with increased ICP and decreased LOC. Question 11. A 4-year-old client with intractable seizures has been on A. The nurse suspect. Appendicitis, bowel obstruction, urinary tract infection, kidney stones. D. Kidney stones. Correct answer. In this scenario, the correct answer is D. Kidney stones. The ketogenic diet, which is high in fats and low in carbohydrates, can lead to an increased risk of kidney stone formation due to several factors. Firstly, the diet can result in a low urine pH, which promotes the formation of certain types of kidney stones. Additionally, the diet may lead to dehydration and reduced urinary citrate levels, further contributing to stone formation. Children on a ketogenic diet should maintain adequate fluid intake to prevent kidney stone development. Regarding the incorrect options, A. Appendicitis. Appendicitis is not directly related to the ketogenic diet. The symptoms of appendicitis typically include right lower quadrant abdominal pain, not left-sided pain as described in the scenario. B. Bowel obstruction. Bowel obstruction is also not a common complication of the ketogenic diet. Symptoms of bowel obstruction would include abdominal distension, vomiting, and constipation, rather than left-sided pain. C. Urinary tract infection. While urinary tract infections can occur in children, the left-sided pain described in the scenario is not a typical presentation of a UTI. UTI is usually present with symptoms such as urinary urgency, frequency, and dysuria. Educationally, This question highlights the importance of understanding the potential complications associated with specific treatments, such as the ketogenic diet in children with seizures. Nurses caring for pediatric patients on this diet need to be vigilant for signs and symptoms of kidney stones and educate both the child and their caregivers on preventive measures, such as adequate hydration and monitoring for symptoms of kidney stones. Question 12. A child with a history of seizures arrives in the emergency department, ED, in status epilepticus. Which is the priority nursing action? Take vital signs. Establish an intravenous line. Perform rapid neurologic assessment. Maintain a patent airway. D. Maintain a patent airway. Correct answer: when a child with a history of seizures presents in status epilepticus, the priority nursing action is to maintain a patent airway. This is crucial to ensure proper oxygenation and ventilation. Establishing an intravenous line and performing other assessments are important, but maintaining a patent airway takes precedence to prevent hypoxia and ensure the child's safety. Question 13. The caregiver is teaching a parent of a young child with a newly diagnosed seizure disorder. The child is prescribed valproic acid, Depakote, for control of seizures. Which parental statement indicates the need for further education? I will not use carbonated beverages to dilute his medication. I will give his medication with food to minimize gastrointestinal upset. I will not let him chew his tablet. I will bring him to the physician's office for regular blood work to check his blood levels. B. I will give his medication with food to minimize gastrointestinal upset. Correct answer. The correct answer is B. Valproic acid should be administered with food to reduce the risk of gastrointestinal upset. Giving it on an empty stomach may increase the likelihood of adverse effects. The other statements are correct. A. Carbonated beverages should not be used to dilute the medication. C. The tablet should not be chewed. And D. Regular blood work is necessary to monitor valproic acid levels and potential side effects. Question 14. A young child admitted to the pediatric unit has fever. The nurse anticipate based on these data. Decreased protein count. Clear, straw-colored fluid. Positive for red blood cells, RBCs. Decreased glucose level. D. Decreased glucose level. Correct answer. In a young child with suspected bacterial meningitis presenting with fever, irritability, and vomiting, the nurse should anticipate a decreased glucose level in the cerebrospinal fluid, CSF. This is because bacterial meningitis causes an inflammatory response in the central nervous system, leading to increased consumption of glucose by the infecting organisms and inflammatory cells. A decreased CSF glucose level is a hallmark finding in bacterial meningitis and indicates the presence of an infectious process. Option A, decreased protein count, is not the expected finding in bacterial meningitis. In fact, bacterial meningitis typically presents with an elevated protein count in the CSF due to the inflammatory response. Option B, clear, straw-colored fluid, is not indicative of bacterial meningitis. In meningitis, the CSF is typically cloudy due to the presence of increased white blood cells and protein. Option C, a positive for red blood cells, RBCs, is not a characteristic finding in bacterial meningitis. The presence of RBCs in the CSF may suggest a traumatic tap rather than an infectious process. Educationally, understanding the expected CSF findings in bacterial meningitis is crucial for nurses caring for pediatric patients. Recognizing these key diagnostic indicators can help in prompt identification and treatment of this potentially life-threatening condition. Nurses must be knowledgeable about interpreting CSF results and understand the implications for patient care and management. Question 15. When planning care for a pediatric client diagnosed with bacterial meningitis, what is the priority nursing diagnosis? Impaired gas exchange. Risk for infection. Anxiety, parental. Acute pain. A. Impaired gas exchange. Correct answer. The priority nursing diagnosis when caring for a pediatric client with bacterial meningitis is impaired gas exchange. This diagnosis takes precedence due to the potential for respiratory complications associated with the condition. Bacterial meningitis can lead to increased intracranial pressure, compromising the child's ability to ventilate adequately. Therefore, monitoring and addressing any signs of respiratory distress are crucial in the care of these patients. Question 16. The healthcare provider is caring for a 9-month-old infant. The nurse question. Vital signs and neurologic checks hourly. Small, frequent formula feedings. Elevate the head of the bed. Daily head circumference measurements. C. Elevate the head of the bed. Correct answer. Elevating the head of the bed in a child with hydrocephalus can potentially increase intracranial pressure. This can be counterproductive and may lead to complications after shunt placement surgery. Keeping the head of the bed flat or slightly elevated is often recommended to optimize cerebral perfusion and reduce the risk of increased intracranial pressure. Question 17. A neonate with a meningomyelocele is scheduled for surgery in the morning. Which nursing action is appropriate for this neonate? Applying a diaper to prevent contamination of the sac. Positioning the newborn in a side-lying position. Encouraging the mother to hold the newborn because she will not be able to pick him up after surgery. Positioning the newborn in a prone position. D. Positioning the newborn in a prone position. Correct answer. The correct answer is D. Positioning the newborn in a prone position. In the case of a neonate with a meningomyelocele scheduled for surgery, positioning the newborn in a prone position is crucial. Placing the newborn in a prone position helps to prevent pressure on the sac, reducing the risk of rupture or damage to the exposed spinal cord. This position also facilitates optimal surgical access and minimizes the risk of complications during and after the procedure. Option A. Applying a diaper to prevent contamination of the sac is incorrect because covering the sac with a diaper can increase pressure on the sac and lead to complications. Option B. Positioning the newborn in a side-lying position is incorrect as it does not provide the necessary support and protection for the exposed spinal cord. Option C. Encouraging the mother to hold the newborn because she will not be able to pick him up after surgery is incorrect as holding the newborn may put pressure on the sac and is not the recommended positioning for this condition. This educational context is essential for pediatric nurses to understand the rationale behind the appropriate positioning of neonates with meningomyelocele to provide safe and effective care before and after surgery. By following evidence-based practices, nurses can contribute to better outcomes for these vulnerable patients. Question 18. What side effects should the nurse include in the parent teaching for a child prescribed a baclofen pump for cerebral palsy? Diarrhea, hypertonia, hypotonia, restlessness. C. Hypotonia, correct answer. When a child is prescribed a baclofen pump for cerebral palsy, one of the common side effects to include in parent teaching is hypotonia. Baclofen, a muscle relaxant, can lead to decreased muscle tone, resulting in hypotonia. It is important for parents to be aware of this potential side effect and know how to respond accordingly. Question 19. A 9-month-old infant who is not sitting independently has been diagnosed with ataxic cerebral palsy, CP. Which clinical manifestations would the nurse expect to see in the baby? Hypotonia and muscle instability. Hypertonia and persistence of primitive reflexes. Tremors and exaggerated posturing. Hemiplegia and hypertonia. A. Hypotonia and muscle instability. Correct answer. In ataxic cerebral palsy, the characteristic features include hypotonia, low muscle tone, and muscle instability. These manifestations contribute to the infant's difficulty in achieving independent sitting. Hypertonia, increased muscle tone, and persistence of primitive reflexes, as mentioned in option B, are more commonly associated with other types of cerebral palsy. Tremors and exaggerated posturing, option C, are not typical features of ataxic CP. Hemiplegia, paralysis of one side of the body, and hypertonia, increased muscle tone, mentioned in option D, are more commonly seen in other types of cerebral palsy, such as spastic CP. Question 20. A pediatric client is admitted to the emergency department. The nurse suspect based on these data: spinal cord injury, increased intracranial pressure, typical for sleep, improvement. B. Increased intracranial pressure, correct answer. The vital signs of bradycardia, hypertension, and irregular respirations indicate increased intracranial pressure. Bradycardia, heart rate of 48, hypertension, blood pressure of 148/74 mmHg, and irregular respirations are typical signs of increased intracranial pressure in a pediatric client with a traumatic brain injury and loss of consciousness. Question 21. Which clinical manifestation should a nurse monitor for when assessing a pediatric client diagnosed with a basilar skull fracture? Periorbital ecchymosis, subdural hematoma, protruding bone, epidural hematoma. A. Periorbital ecchymosis, correct answer. Periorbital ecchymosis, also known as raccoon eyes, is a classic sign of a basilar skull fracture. It presents as bruising around the eyes due to blood collecting in the tissues. Monitoring for periorbital ecchymosis is crucial in assessing a pediatric client with a basilar skull fracture because it can indicate the presence of this serious injury. Question 22. A teacher states to the school nurse, "I have a student who," the nurse include in the response to the teacher: "The child has a crush on the teacher. The child has increased intracranial pressure. The child may have had a head injury. The child is experiencing absence seizures." D. The child is experiencing absence seizures. Correct answer. In this scenario, the correct answer is D. The child is experiencing absence seizures. Absence seizures are a type of generalized seizure characterized by brief episodes of staring or lack of responsiveness, often lasting for a few seconds. By selecting this option, the nurse can guide the teacher to consider a potential medical explanation for the child's behavior, prompting further evaluation by a healthcare provider. Option A. The child has a crush on the teacher is incorrect as it does not address the medical aspect of the child's behavior and is not a typical response in a healthcare context. Option B. The child has increased intracranial pressure is unlikely in this case, as it typically presents with more severe symptoms. Option C. The child may have had a head injury is less likely as the behavior described is more indicative of absence seizures than a head injury. In an educational context, it is crucial for healthcare professionals working in pediatrics to have a broad understanding of various conditions that can affect children's health and behavior. By recognizing the signs of absence seizures, nurses and teachers can collaborate effectively to support the child's well-being and academic success. This case highlights the importance of considering medical conditions when addressing behavioral concerns in children. Question 23. The healthcare provider is providing care to a child who was treated with aspirin during a viral infection. Which clinical manifestations should cause the healthcare provider concern? Nausea, vomiting, and confusion. Headache, vomiting, and seizures. Sore throat, moist respirations, and cough. Fever, rash, and photophobia. A. Nausea, vomiting, and confusion. Correct answer. The symptoms of nausea, vomiting, and confusion are concerning as they are indicative of Reye's syndrome, a rare but serious condition associated with aspirin use in children during viral illnesses. Reye's syndrome can lead to severe complications, including brain and liver damage. Hence, prompt recognition and management are crucial. Question 24. When the home health nurse visits the home of A, the nurse discusses with the mother. The mother leaves the filled mop bucket on the floor while in another room. The mother turns all pan handles to the back of the stove. The mother fills the bathtub before bringing the baby into the bathroom. When riding in a car, the child is in a car seat in the middle of the back seat. A. The mother leaves the filled mop bucket on the floor while in another room. Correct answer. The correct answer is because leaving a filled mop bucket on the floor poses a drowning hazard for a 10-month-old child. Water in the bucket can be a potential drowning risk if the child falls into it. Pan handles turned to the back of the stove prevent accidental spills or burns. Filling the bathtub before bringing the baby into the bathroom helps in preventing burns from hot water. Placing the child in a car seat in the middle of the back seat provides safety by minimizing the risk of injury during a car ride. Question 25. Which clinical manifestations should the nurse anticipate when assessing a child admitted to the hospital unit with a diagnosis of minimal change nephrotic syndrome, MCNS? Massive proteinuria, hypoalbuminemia and edema, hematuria, bacteriuria, and weight gain. Decreased urine-specific gravity and increased urinary output, gross hematuria, albuminuria, and fever. A. Massive proteinuria, hypoalbuminemia, and edema. Correct answer. Minimal change nephrotic syndrome, MCNS, is characterized by massive proteinuria, hypoalbuminemia, and edema. Proteinuria results from the loss of proteins, particularly albumin, in the urine, leading to hypoalbuminemia. The low oncotic pressure due to hypoalbuminemia causes fluid to shift into the interstitial spaces, resulting in edema. These clinical manifestations are classic signs of MCNS and help differentiate it from other renal conditions.